So the first skin cancer check can be quite intimidating for most people. Usually we'll check you in, we'll walk you through, and I will spend a couple of minutes to just have a chat to you, get some background history, assess your skin cancer risk. The rooms are always either air conditioned or heated, so there's always a comfortable temperature. For the skin cancer check, I do explain that we expect everyone to strip down to underwear. There are certain circumstances where we might ask you to remove, for females, to remove the top, or certain patients have requested in certain areas that they want to examine some areas underneath the underwear. I'll always confirm that with the patient before we start or during the examination. If you're feeling a bit uncomfortable, we can also provide modesty drapes and work one area at a time. So it depends on what you're feeling comfortable with. I'll always run you through it step by step and make sure that it's not too unpleasant in the end. Usually very systemic, so we usually start from head all the way down to the bottom, with very good lighting in our clinic and with a handheld dermatoscope to examine that certain lesions that look suspicious in 10 times magnification with a special type of light. Obviously since COVID, we've actually altered a little bit, and the face will be light, so you're always wearing a mask just to keep yourself a bit protected for a bit longer. I always like to ask patients what lesions they're concerned about, and I always double check it. But I will also still be systemic and go through all the areas and highlight the areas that they're concerned about as we go along. And also any areas that, their friends or family members might have noted that they think is a bit suspicious as well. So with my examination, I am examining almost every nook and cranny that is exposed. So between the fingers, fingernails, behind the ears, and then between the feet, between the toes is always a spot as well. Around the bra straps, a little bit underneath on the bottom, and I always do a bit of a rummage through the hair as well. So apologize if I ruin your nice hair, but it has to kind of come undone, and I'll always look through the scalp as much as I can. The hardest thing for a skin check is if there is heavy makeup on. We do have makeup removal wipes, and sometimes that happens because of your schedule. The patient has to go to work during the day, and they've got to check in the afternoon. They've already got makeup on, but I do need to remove the makeup so that I can examine the skin without any coverage on there, nothing to hide any blemishes, so we can do a thorough examination. It's always nice to have a list of spots and concerns. If you have family members who have any skin cancers, it's good to know what kind of skin cancer they've had. That's useful information for me as well.